Good morning, afternoon, evening, or night, whenever or wherever you're tuning into this podcast from, and welcome to CityCast. I know it's been a while, and you missed us, but we are back and we are better. My name is Darren.
And my name is Priya. We're both current students at CityLab at McMaster, and we will be your hosts for today's episode. Before we dive in, we wanted to give a quick shout out to Randy at CityLab, who inspired us to tackle this topic, and Lions Media Center for supporting us in creating this podcast. Today we're going to be exploring the recent shift from consumption and treatment services, also known as CTS, to the new homelessness and addiction recovery treatment, or HART hubs, in Ontario. This transition has prompted a pretty intense debate amongst policymakers, healthcare professionals, and community members. So Darren and I will be having an unstructured sort of conversation on this topic, unpacking what it's all about and telling you about the issue, exploring the histories, etc., etc. I'm excited to see where this takes us.
Yes, so let's start off by providing some context. So CTS sites have been operational in various Ontario cities, offering a supervised space for individuals to consume pre-obtained drugs under the watchful eye of trained staff. So these sites aim to reduce overdose deaths, prevent the spread of infections, and connect users to health and social services.
Yep, but in August of 2024, Health Minister Sylvia Jones announced that they would be closing 19 of such sites, specifically the ones that are within 200 meters of either a school or a childcare center. Now, these sites have to be shut down or basically turned into a HART hub by late March of next year.
Right. But what is a HART hub? Basically, the main focus will be on providing comprehensive services, so mental health treatment, primary care, and supportive housing. The government has allocated about $400 million to fund this transition.
And I guess the main difference is that CTS sites focus more on immediate harm reduction for people who actively use substances. They provide a supervised space where individuals can use drugs safely, access clean supplies such as needles, and get help in case of an overdose. So the main concern, switching from a CTS to a HART site, is that people in crisis may lose access to the urgent, life-saving care that CTS sites provide.
Right, so it's interesting how this shift reflects broader debates about harm reduction versus treatment-first approaches. Now, a question that comes to my mind, Priya, is do you think policymakers are trying to balance these, or are they leaning too heavily in one direction?
I think it feels like they're prioritizing optics. Even though HART Hub sounds like a comprehensive idea, I think removing CTS services creates this gap that could lead to more public health crises. Harm reduction isn't just a stopgap, it's a lifeline. So I think they're very heavily leaning into one direction.
I think you're so right. And it's not just Ontario. I think other provinces have experimented with similar shifts, and the results have been mixed. An example I could think of off the top of my head is Alberta, when they transitioned from harm reduction-focused model under their supervised consumption services program to a more treatment-centered approach with their recovery-oriented system of care. And the provincial government argued that this shift would emphasize a long-term recovery rather than a short-term harm reduction. But this transition has faced significant backlash from what I've read into. And in Calgary, the closure of these supervised consumption services sites led to increased public drug use, a rise in overdoses in public spaces, and reduction in availability of clean supplies, which has implications for the spread of different diseases like HIV, hepatitis C, and so on. Right, so advocacy groups pointed out that while the intent to prioritize recovery is commendable, the removal of harm reduction services creates and leaves a critical gap, especially for people not ready to or able to enter recovery programs. Do you think Hamilton's prepared to adapt to these changes?
That's a good question. And I feel like it's very interesting to see how there is actual evidence and real examples to back up the fact that this probably won't work, in Hamilton, I feel like Hamilton is unique because it has both urban challenges and like tight-knit community initiatives, but it's also underfunded, especially in areas like mental health and harm reduction, which makes me honestly pretty concerned about how HART hubs would actually function and if they would work.
Yeah, and that's why this decision has been met with mixed reactions. Once again, after reading up on a few articles and having conversations with physicians and therapists, I've gathered that although heart hubs offer a more holistic approach to addiction recovery, closing CTS sites could lead to increased public drug use and overdose deaths, just like we saw in Calgary.
Yeah, and I feel like as students at MAC, we've seen the opioid crisis affect downtown Hamilton. I mean, like coming to class in City Lab every day, I think we have a pretty good sense of how things are. And yeah, I guess what I'm asking is like, what stands out to you, Darren, about harm reduction in this city specifically?
I think it's the visibility of it. I mean, you can see people struggling openly on the streets, yet there's an underlying stigma that stops real solutions.
Mm-hmm.
I think CTS sites offered a non-judgmental space, but with them gone, like, what do you think happened next or happens next?
Exactly. I feel like even walking past like shelters or outreach programs, you can tell that there's definitely a need for immediate harm reduction measures. And like removing CTS sites feels like a step backward, especially for Hamilton. I don't know. I read up actually on something that Dr. Green said. She's a family physician in Toronto, and she expressed her opposition to the closure, saying that she's super opposed to the government's reckless decision to close these sites. So it's like, it's not just the public or the policymakers, even a physician is saying this, you know?
Right. And statements like Dr. Green shows the frustration in the medical community, right? So do you think the public fully understands what harm reduction sites actually do?
I think probably not. People often think that they're enabling of drug use, but I feel like that's such a narrow view, you know? Because harm reduction is more about safety and survival. Maybe like the government could have focused on educating people about CTS instead of just shutting them down.
That's very true. And even on campus, harm reduction is often misunderstood. An example that I could think of is how many students know about safe consumption kits some wellness centers provide or about overdose prevention programs.
Definitely not enough. Wait, does PG Wellness provide these? I don't know.
No, they don't.
They don't? Okay, that's interesting.
Or no, they do.
They do?
Yeah.
Okay, that's good to know.
Okay.
But yeah, that's exactly our point. Like, not enough people know about it. And I feel like that's why conversations like these are pretty important. It's not just about, like, advocacy. It's about changing the whole narrative around addiction.
Yeah, and I mean, even the Registered Nurses Association of Ontario has voiced concerns. The director of policy there, Matthew Kelway, has said that to pose harm reduction in opposition to treatment, as this government does, is profoundly dishonest or ignorant. It is all part of the same complicated continuum of care for people with substance use disorder.
Yeah, so, I mean, I feel like, let's think about this. What if CTS and heart hubs coexisted? Like, could that bridge the gap between immediate harm reduction and long-term recovery?
I think it could work, but only if both were fully funded. Right now, it feels like heart hubs are being prioritized at the expense of CTS, which more so undermines the idea of the continuum of care.
Exactly. By cutting one out to fund the other, I think we're losing the more short-term solutions that keep people, like, alive long enough to even consider recovery, you know? And even, like, Doug Ford, he defended the closures. He cited, like, community safety concerns. He said something like that parents are worried about the discarded needles that their children could pick up. So, I don't know, some parents no longer feel comfortable sending their children to the local elementary school or have pulled them out of their local daycare, things like that. So I guess his focus is more on, like, community safety, and, like, that's the point that he made.
Right, valid concerns. But do you think it's overshadowing the bigger picture?
I mean, definitely. I mean, I get that discarded needles are a legitimate worry, but CTS sites, I feel like that's the whole point. Like, they actually do address that issue because they provide proper disposal techniques. So without them, you probably will see an increase in, like, unsafe public drug use and like discarded needles. I feel like that's just, I don't know, it doesn't make sense to me.
Right. And I wonder how much of this is about managing public perception rather than addressing actual public health concerns, right? So the fear of addiction often leads to reactive policies rather than proactive solutions. I think it's important to note that some of the CTS sites set to close have confirmed plans to apply for HART Hub funding. For instance, the South Riverdale Community Health Centre in Toronto is collaborating with 11 other organizations to develop a HART Hub. However, they expressed concern saying that the HART Hub model does not provide CTS services, which is an essential entry point to healthcare programs and services and an integral component to the continuum of care for people who use drugs.
Yeah, and they can't like do both because they can't like integrate CTS into a HART Hub, mainly because like of a lack of funding and policies that actually prioritize a full like spectrum of care, I guess. Plus, there's definitely like a stigma around CTS sites, right? The idea of a CTS site faces way more opposition from the public and from policymakers than the HART Hub idea.
Right. So when we talk about all these things, something that always comes up to my mind is what can we, as students do to advocate for harm reduction? I feel like as students, this topic is brought up so much or to an extent to people who are exposed to it, especially through different resources like the Student Wellness Center, as you mentioned before, and we kind of touched on. But do you think it's as simple as raising awareness, or should we push for policy changes?
I think both. Students have a very powerful voice that they sometimes don't realize, especially in like cities like Hamilton. Like we make up a big chunk of the population here. So even just like joining local advocacy groups or starting like campus dialogues about harm reduction, I feel like that could actually make a real difference that people don't really realize.
Right. And I agree. I think even just educating ourselves and others about what harm reduction means is just a step forward, right? The more informed we are, the better we can challenge harmful narratives.
Yep, for sure.
As the situation unfolds, I think it's crucial to monitor the impact of or on both individuals struggling with addiction and the broader community.
We encourage our listeners to stay informed and engage in discussions about these developments. Your voice does matter in shaping the future of addiction services in our communities.
That's pretty much all we have for today, but on behalf of CityCast, thank you for joining us on this episode. And if you have thoughts or experiences related to today's topic, we'd love to hear from you. So stay tuned for our next episode where we'll explore different issues, or the topics are actually to be determined. But until then, CityCast is out. My name is Darren.
And I'm Priya.
And thank you for listening today.